Welcome to Your Medicare Minutes. In this episode, we're talking about new to Medicare. If you're just getting started, you might be feeling a little overwhelmed, but don't worry, we've got you covered. Medicare is health insurance from the federal government for people 65 and older, or younger folks with certain disabilities or chronic conditions. Medicare is broken down like this. Part A is hospital insurance, which covers inpatient care, and Part B is medical insurance, which covers outpatient care. The initial enrollment period, or IEP, is your first chance to enroll in Medicare. It's a 7-month window. The 3 months before your 65th birthday, your birthday month, and the 3 months after. If you're already getting Social Security retirement benefits when you turn 65, or if you've been receiving Social Security disability insurance for 24 months straight, you'll probably be enrolled automatically. If that's you, keep an eye on the mail. Your Medicare card will come in a package. If you miss your initial window to enroll, there are a few other times when you can sign up through Social Security. The Special Enrollment Period, or SEP, is for people who delayed enrolling because they had other health coverage, like from an employer. If your employer coverage meets the standard, you enroll without a late penalty once that coverage ends. The General Enrollment Period, or GEP, happens every year from January 1 to March 31. But heads up, if you use this one, you might have to pay a late enrollment penalty, and there could be gaps in your coverage. And here's a tip. If you qualify for premium-free Part A, most people do based on their work history, then you can sign up for that anytime you're eligible. But for Part B, or premium-based Part A, you'll need to stick to one of those enrollment windows. Once you're enrolled, you have a decision to make between Original Medicare or a Medicare Advantage plan, also known as Part C. Here's a simple comparison to help you decide. Original Medicare comes directly from the government. You can go to almost any doctor or hospital in the U.S. that takes Medicare. No provider networks or referrals required. Medicare Advantage plans are offered by private companies and may have their own provider networks. They often include Part D, which is prescription drug coverage, and may offer extra perks like dental, vision, or hearing. Just remember, no matter which you pick, you still pay for your Part B premium, and maybe Part A too if it's not free for you. Medicare Advantage might have an extra monthly premium. If you stick with Original Medicare, you'll need to sign up for a separate Part D plan. You can also buy a Medigap policy if you have Original Medicare to help with out-of-pocket costs like copays and deductibles. Let's talk more about Part D and Medigaps. Part D is for prescription drugs. If you have Original Medicare and want drug coverage, you'll need to enroll in a standalone Part D plan through a private insurance company. Medigap policies are also sold by private companies and only work with Original Medicare, not Medicare Advantage. They help cover costs that Medicare doesn't fully pay, like deductibles or coinsurance. In New Mexico, it's best to enroll in a Medigap during your Medigap open enrollment period, a one-time 6-month window that starts the month you're both 65 and enrolled in Part B. Using My Healthcare Tracker is a great way to stay on top of your Medicare benefit. This free booklet is available through the Senior Medicare Patrol, SMP. It lets you jot down the details of your doctor visits. Then you can compare your notes with the Medicare statements to check for errors or even spot fraud. It's a simple tool that can really help protect you and possibly save you money. Starting Medicare can feel like a big change, but we are here to help make that transition easy. That concludes this edition of Your Medicare Minutes. I'll be back with more information on Medicare, aging, and being prepared in the next episode.